Hi, I'm Dr. Crider at Nura Regenexx Edina. Thanks for joining us today for this webinar on maintaining orthopedic health while remaining active as we age. I think it's been an interest of mine for a long time and hopefully will be useful for those of you out there as well. So there's a lot of examples in professional sports of athletes that have managed to avoid kind of that inevitable decline with age and increased risk of injury, recover more quickly to compete in this many events in that short of a time. Unfortunately, the players themselves often don't even know what gave them that longevity or success. There's a phrase, just because you're a bird doesn't make you an ornithologist. But they are being very conscientious about it with a full team of people devoted towards helping them recover more quickly, and hopefully we'll be able to take some lessons from these successful players as well. What this talk will not be is looking into the wellness industry or anti-aging industry. Unfortunately, there is this whole industry based on selling products, a lot of which it has minimal scientific evidence behind it. So, you know, you've got Gwyneth Paltrow with stem cellular booster serum for skin health. Obviously, without any stem cells in that, I would recommend using SPF 15 to 30 sunscreen and moisturizer every day, and that's going to be probably the best thing for your skin health. You don't need to spend $100 on stem cellular. And then you've got obviously Tom Brady, who is recommending, you know, diets avoiding acidic foods or nightshade groups or hydrating to avoid sunburn. A lot of these things are all being promoted in order to sell a product, and so we'll be focusing more on kind of known causes of aging and kind of an orthopedic approach to maintaining joint health. This talk will also not be looking into like hormone replacement, which is, you know, a reasonable approach for the right patient, but is also maybe overused in some people. So that's kind of a separate talk. I'm not against it, but this will be more on orthopedics. So we're going to be looking at, well, orthopedics and just aging in general, because that's also just an interest that I think is kind of mysterious to a lot of people. So how we age and how that can be altered, maintaining fitness with specific muscle groups and exercises that are important for staying injury-free, how to restore joint health, and specifically looking at joint stability through muscles, tendons, ligaments, and the nerves that provide that stability, provide the input to the muscles, and how regenerative medicine can fit into that to help prevent injury. And then generally what my field is, interventional orthopedics, and how that's different in some ways from the traditional surgical orthopedics. So we'll be starting with kind of some of these main theories of aging. So there's the oxidative stress and free radical theory, the idea of glycation causing damage to proteins, how telomeres, your DNA changes with each replication cycle, just the use it or lose it of age-related loss of muscle, of bone, things like that. How wear and tear accumulates through instability and what can be done there, and the role of stem cells in repairing degeneration over time. So oxidative stress, the idea here is that there are things called free radicals that are from your environment in the cases of UV light, air pollution, or ionizing radiation, smoking. They also come as a byproduct of your own body making energy from food. So the metabolism causes the creation of free radicals naturally. It happens. Free radical is an atom that's got one too few electrons, and so it wants to steal one from a healthy atom that has a normal number of electrons. So it's very reactive. It reacts with your DNA, your collagen, blood vessel walls, causing, you know, mutations in your DNA and damage to your proteins and blood vessel linings, which can lead to things like strokes, heart attacks, cancer. So there are antioxidants, which have an extra electron that they can then donate and neutralize free radicals. And those are present in many of the healthy fruits and vegetables. We'll talk about those. There's, you know, obviously the idea would make a lot of sense to simply supplement antioxidants to bind up the free radicals. Unfortunately, that hasn't really panned out in a lot of the large studies. Instead, what that ends up doing is blocking your own body's natural antioxidant defense syndrome. By flooding the antioxidants, your body no longer produces antioxidants. and then you have maybe less ability to fight cancer and such. So no longer recommending high dose selenium or vitamin E or something like that as an antioxidant. Diet high in phytochemicals would have the antioxidants necessary to help neutralize the free radicals that will be produced inevitably through your metabolism. To do that, you would want to eat the rainbow. So look for the colorful foods, fruits and vegetables. Those are the color providing molecules are the ones that are often also the antioxidants. So cruciferous vegetables would include things like broccoli, collards, Brussels sprouts. Those have things called isothiocyanates. Beta carotene is what gives carrots and squash and yams that orange color, and it's a strong antioxidant. The anthocyanins are what makes blueberries and grapes blue or purple. So a lot of berries are high in that. That's a good antioxidant. Polyphenols are what's in tea, particularly green tea, and may have some anti-aging properties. And resveratrol is a type of a polyphenol, which is in red wine. It's a good antioxidant supplement that's been linked to anti-aging and things like that. So you could certainly supplement them, but I think the best way to get it is through a diet that's broad and multicolored. Whole grains also are high in fibers, and fiber itself may also help with such damage. The next step would be avoiding things that cause more damage, more free radicals. And so the foods that are high in producing free radicals are things that have been deep fried, saturated fats, and red meats. If you heat an oil past the smoke point, so every oil has a certain temperature above which it will start to let off smoke. And at that point, it's actually reacting and forming free radicals. And so you only want to cook at a temperature below that smoke point, so you need to choose the right oil. So olive oil is great in dressings and on bread, but if you're cooking with olive oil, chances are good that it's getting too hot. It's a very low smoke point. So if you're frying things in olive oil, you're actually causing free radicals, which would cause more damage. Processed meats have also been linked to cancer through that pathway. Getting inadequate sleep, sleep may be related to and stress to your body's repair mechanisms. And so if you're chronically if you're chronically tired, then you're not going to have as good of a defense in that sense. And like I said, you could certainly supplement some antioxidants. Turmeric is a good one that is kind of a master regulator of inflammation. Fish oil, and then resveratrol is the one that's probably been most researched as an antioxidant for aging. Glycation is the second step of age-related degeneration, and this is from sugars reacting with proteins. So your body is made of multiple types of proteins, not just your muscles, but also collagen, tendons, ligaments, cartilage. And when sugar binds to it and reacts to it, it causes that protein to become brittle and change shape. That may be part of how blood vessel linings become more damaged with time from like diabetes leading to vascular disease, strokes. Also just how you get wrinkles in your skin from the collagen in your skin becoming more brittle, in part from sun exposure, in part from this glycation process. So increases risk of having high sugars in your blood, increases risk of cancer from DNA, heart disease, stroke as it reacts with your blood vessels. And obviously having more brittle tendons and ligaments puts you at more risk of tendinitis, tendon tears, orthopedic injuries. So it does not mean that all sugar is bad. You need to cut out all sugar from your diet. Carbohydrates are the primary source of fuel for humans. But it does mean that you want to keep your blood sugars within a normal range. And the way to do that is to avoid foods that cause a spike in blood sugars. When you have a very high blood sugar, then your body has to put out a lot of insulin to try to drive that sugar into your muscles. And if you're constantly at that high blood sugar state, then your body starts to become resistant to the insulin you produce. So pre-diabetes is really the time to intervene here. Pre-diabetes means you're becoming you have chronically high sugar levels, and your body is starting to become resistant to the insulin, and no longer is the insulin working as well. By the time you're diagnosed with actual full-blown diabetes, half of your insulin beta cell function has already been lost. So you're no longer, your pancreas starts to fatigue from trying to produce so much insulin, trying to keep your blood sugars down. So a dietary approach to that would be to avoid foods that spike blood sugars that become sugar instantly in the body. So obviously Kool-Aid, Wonder Bread, processed foods, simple sugars, things like that. Things that are low glycemic index. Glycemic index means how quickly it converts to sugar in the blood. Versus whole grains, foods that are more bound up with fiber are released more slowly. Those are high glycemic index foods, released more slowly and do not cause that spike of blood sugars. Another factor in glycation are these advanced glycosylated end products. So this comes from from charred or browned foods. So if you're charring meat on the grill, that's going to produce a lot of these AGEs, which can lead to that degeneration we talked about. Even carbohydrates that are cooked like that, so burned toast, really fried brown, blackened potatoes, things like that are going to have these AGEs that contribute to aging. And then some of these other snack foods also have a lot of AGEs in them. So I still grill, but if I do have a really charred up piece, I'll cut that piece off rather than eating it. And I do try to reduce, smoked meats and things like that that are higher in these. Acidic marinades may help. So if you are going to grill, you could certainly use an acid-based marinade. Telomeres are another theory of how aging may contribute over time, how cells start to degenerate. So with each cell division, there's a cap on the end of your chromosome, which gets a little bit shorter each time until eventually, and that cap is non-coding is the nice part. So you're not losing anything each time it shortens until you get to this critical point where you're out of the telomere cap and now you're starting to lose coding DNA, active DNA. And at that point, either the cell stops dividing or you can start to get mutations. So this is thought to be why after a certain number of replication cycles, we are no longer able to keep replicating our cells. Now there is this enzyme called telomerase, which is in stem cells and cancer cells and allows the cell to continue to replicate past that normal number of cycles at which their telomeres would have gotten too short. Obviously, it's good in the case of a stem cell that it's able to keep dividing throughout your life cycle. Bad in a cancer cell that normally that's a good break that keeps the cell from dividing. But if it's able to make telomerase, then it can just keep on dividing. So the natural ways to increase the length of your telomeres is be through a healthy diet, exercise, and low stress. They can actually look at the length of your telomeres and compare your chronologic age to your telomere age. How shortened are your telomeres relative to how short they would expect them to be in people that are able to maintain these healthy lifestyle things? Actually, it does actively increase the length of the telomeres. There are telomerase supplements. I'm not taking them at this point just due to that risk of, they don't know that it wouldn't cause cancer if that lack of telomerase is one of the brakes on cancer formation that has not yet played out. But it's a new enough thing too that there aren't evidence that it would increase lifespan. So I'm waiting on the telomerase and just doing diet, exercise, and mindfulness. Fourth cause of age-related decline is just use it or lose it. So this is an example of sarcopenia. These are two women that have the same BMI, so the same size, similar cross-sectional area, but you see one of them still has good muscle mass, and the other one, a lot of that muscle has now been replaced with fat. And that's called sarcopenia, and that's just from inactivity, mostly age-related loss. Similar thing happens with bone. So bone is actually a dynamic tissue. It lays down new bone with use. And if you're not using it, then if you don't have weight-bearing activity, then it starts to resorb and you get larger vacuoles in here. This is osteoporosis. Osteopenia is just somewhere else on the spectrum, would be kind of between those two. So weight-bearing activity is good for those. And then a lot of these postural muscles that we kind of forget about, but that prevent future wear and tear and are easy to neglect. So in ideal posture, you would have gravity going right down the center line, and you wouldn't need to be activating your muscles very much to keep that natural alignment. Unfortunately, we tend to have weak gluteal muscle or weak abdominal muscles, weak gluteal muscles, tight hip flexor muscles, and we fall into this forward pelvic tilt instead of being vertically aligned. Now, once the pelvis goes forward, our whole body starts to crumple over that line, and it puts a lot of stress on the back of the neck and on the low back. That's anterior pelvic tilt from core weakness. Similar thing, actually, another way to deal with core weakness is to do a posterior pelvic tilt. And with that, you get this sway back posture. Everything comes up and then forward like that. You can see how that puts a kink in the neck. Very common kind of teenage posture here where you don't have to really activate. You're not activating the rhomboids or the glutes, and that puts a lot of pressure on the low back. So ways to combat that. We recommend a mix of aerobic and anaerobic exercise. So add some weightlifting into your routine if you aren't already. Large muscle groups in particular, like the glutes, hamstrings, so doing things like squats, lunges, wall sits, are all really good for overall, not just strength of those muscles, but overall health. The aerobic exercise that you do, you want to be at the level where conversation is difficult, so you should be breathing hard from it. Even just doing like circuit training, going from one station to the next can become an aerobic exercise if you're not recovering fully between them, so that's good to do. Common question is how frequently. You know, there's varying recommendations. 5 days a week, 30 minutes is a good goal, but even less is better than none. And there are benefits to be gained from even just 1 or 2 days a week. And shorter periods are fine too. So high intensity intervals are very popular way to get a very robust exercise response and improvement in strength without having to do a long workout. So that amount of time that you're actually exercising hard might only be a couple of minutes. Definitely want to get some weight bearing activity in there. So if you're a swimmer or biker, you may want to add some kind of weight bearing activity for your bone and tendon health, because if you're not putting forces through them, then they tend to resorb a little bit. So you're more at risk of osteoporosis and tendon weakness. And then core stability exercises are very important for some of those postural changes I talked about. So Pilates is really good for the core. Those tend to focus on this transverse abdominis muscle. Things like planks, bridges, fire hydrant, all activate this, not the six-pack muscle that goes up and down, but it goes transverse. And that's really important for core stability that will then give you better function of the arms and legs with that. Yoga is good for strength. I mean, it certainly is difficult, but it's not as good for stability in some ways because it puts a lot of joints at kind of that end range of motion. And when you're stretching a joint at the end range of motion, it puts a lot of stress on the ligaments. And as ligaments become more loose, the joint is more unstable. So particularly if any of these poses are causing you pain, you don't want to do them. You may want to ask your instructor to modify some of those poses. And if you know you have issues of instability, then you probably don't want to do yoga, and Pilates may be a better option for you. So this is how some of those postural muscles influence up and down the kinetic chain. So normally when you're standing on one leg, this side of your body is going to want to tip down, and that's counteracted by this gluteus medius muscle on the outside of your hip, which pulls down on this bone, which pulls the other side up. So that's what keeps your pelvis straight in single leg stance. And a lot of people neglect this muscle, and it wears off, and then you see more of a kind of a waddling gait where the hip tips down with each step. On the unsupported side, you have to move your whole center of gravity over to still be over your stance leg, versus here, this leg would be unsupported if you had a strong muscle to support the opposite side. So that manifests itself in a lot of ways: running, walking, skiing, squats, and weightlifting. So this would be someone with a strong gluteus medius, keeps the knee out. When that muscle on the outside of the hip isn't able to pull that knee out, it tends to want to go into this collapse, which you can see puts a lot of stress on the inside of the knee. So if you do a squat and you find yourself like that, talk to your physical therapist or trainer on how to work this gluteus medius muscle. Will have benefits kind of in multiple sports and even in daily life. Two other things that you could want to be aware of that are common. One is called this upper cross syndrome. So this is a byproduct of our cubicle desk-related life, where everything is in front of us. So our head tends to come forward. We're not using these neck flexors to keep our head above our shoulders. Our pecs and everything in the front get really tight from kind of being curled forward. These traps and levator scap that normally activate back here to pull the shoulder back and the head back, they become so tight and stretched in a long position that they're not able to really activate very well. And we're not using those rhomboids, like I said, to pull the shoulder blades back. So this is like holding a bowling ball out away from your body. Your arm gets very tired holding your head out in front of you, or your neck gets tired holding your head out. Your arms would get tired holding a bowling ball out. versus if you hold that bowling ball close to your body, it doesn't take a whole lot of energy. So by really strengthening and activating these posterior parts, you can pull everything into alignment, take a lot less stress out of the upper neck back area, which has many functional uses. So in this kind of posture, it's very difficult to really use the shoulder. You have much less range of motion of the shoulder, so sometimes people will come in with shoulder problems, rotator, even labral tears, and it's related to the rotator cuff muscles and these kind of just the whole way that the shoulder blade sits on the torso, related to these muscle imbalances. So you got to look beyond just the shoulder, but actually what movement patterns got them in that state. Same thing can happen in the low back, where a lot of us end up with these weak abdominal muscles and go into more of this sway back position to not have to activate those abs. And with that, you also inactivate the glutes. So you're not really using either of them. Instead, you just kind of like lean back. And that puts a lot of work on these low back muscles. And you also get really tight hip flexors from it because that all gets real tight. And so you don't really notice the tight hip flexors as much. Unless you're running or something. But these low back muscles really end up bearing the brunt of standing like that. So really working on those abdominals and glutes can address this kind of standing posture that's so common and influence a lot of the low back and hip flexor issues that are commonly difficult for everybody. What else protects joints? So that's our ultimate goal as athletes, is to protect our joints and be able to use them at a high level. Ligaments are kind of the final restriction of end range of motion. So these are like duct tape that go along, and this is in the case of the back, but you'll see examples elsewhere. That's this red stuff that really keeps things from moving too much. If those get loose, then that joint becomes unstable, like a loose tire that wears out more quickly. And same thing can happen in any of your joints. So these are all joints in your back where you go kind of down like that or up like that. So this is a joint at each one of these levels. And then it's also essentially a joint between each of these two blocks. The disc is basically a joint as well. So that's why the discs wear out in people, is from looseness of these ligaments in the back of the back particularly. Hopefully you won't be relying on just your ligaments to hold you together, because you have muscles that are activating. So the muscles actually keep you in a healthy range of motion so that you're not stretching out those ligaments. However, if the nerve input to the muscles is impaired, then those muscles don't fire properly. You get trigger points, you get cramping, spasming, and then you're more likely to be in a position where you're actually damaging your ligaments. So, and then the third thing that can influence joint health is not just the stability from those, but the cells that are in the tissues that are able to repair the chronic small injuries that are going to accumulate with life. But if you're able to keep up with those small injuries, then you don't develop actual damage that you notice in the future. So we'll talk about how to really address all of these issues as well. So this is a neat video talking about how instability from nerve damage causing muscle weakness in the hip can cause abnormal movement in the knee and ultimately knee damage. So this is by Dr. Centeno, who's the founder of Regenexx out in Colorado. He has a bad nerve in his back. Doesn't even cause him back pain most of the time, but it does influence that same muscle on the outside of the hip that keeps the knee from moving inwards. So this is a good video. So that was a good video. In that case, if he had strengthened that muscle on the outside of his hip, then when the knee landed, it wouldn't have wanted to dive in so bad, similar to that squat picture that we saw. Unfortunately, as long as that nerve is damaged to the to the muscle, no amount of physical therapy is really going to be able to correct that. So you really have to treat a little further upstream in that case. So this is another image of the same idea. This would be more similar to a knee, where you've got the joint with the cartilage on it that's protected by ligaments. But if you're relying on these ligaments to hold you together, you're in trouble, because really it should be your muscles that keep you in that range. And the muscles are relying on the nerves to be functioning. So things that stabilize your joint. One of the big ones are labrum and meniscus. So these are basically little shock absorbers that sit in between the cartilages and kind of deep in the socket, form a suction cup and a spacer. They tend to degenerate with time. So if you scan just anybody on the street, asymptomatic people over age 55, half of them are going to have asymptomatic meniscus tears. So it's an old school way of thinking to scan somebody, see a tear, and go to cut out that tear, cut out that meniscus just because it's there, because it may not be causing their pain. And even with a tear, the meniscus still does an important role of stabilizing the knee. So if you can help it, try not to get your labrum or meniscus cleaned up, trimmed out, any arthroscopic surgeries, because those surgeries are removing not just the tear, but also sections of healthy tissue and making it an unstable meniscus. The muscles, like I said, also control it. So for the core, that transverse abdominis we talked about, the multifidi, or those small muscles in the low back, the glutes, those are all gonna help stabilize your joints. In the shoulder, we talked about rotator cuff, will help keep the ball in the socket a little better so that you're not damaging your labrum. Vastus medialis is one of the 4 quads above the knee. So you got your kneecap sits in here, and for these guys, this VMO on the inner side, actually when it activates, it pulls the kneecap out. Most people kind of neglect that one, tends to get forgotten by our brains subconsciously, and we tend to overactivate the outside one, the vastus lateralis. And so what that does is unopposed pull the kneecap outwards. And as that kneecap rides out here, it tends to rub more. So a lot of people with anterior knee pain, runner's knee, things like that, benefit from specifically strengthening this inner quad to balance out the push-pull or the pull-pull on the kneecap movement. Unfortunately, like I said, if you've got a pinched nerve going to that muscle, you're just going to end up with a bunch of trigger points in that muscle, and it's not going to activate very well. You could do trigger point injections in that muscle, but they're going to tend to recur. So you need to treat both the muscle with therapy, possibly the muscle with trigger points, but also the nerve upstream of that to really get good function in that. And we can do that either by just injecting any kind of fluid around the nerve to relieve mechanical pinching, but specifically we'll often use this platelet lysate, which we can talk about a little more, but it's growth factors from your own blood, which can improve nerve function. So that's a really good thing to be putting around some of these upstream nerves. And then we're also looking at the ligaments that stabilize the knee. We can actually tighten those using platelet-rich plasma. Those are the same kind of cells in your blood that respond to like an ankle sprain. So if you sprain your ankle, rip up all your ankle ligaments, those are all loose. The whole thing swells up and aches. That's these platelets then going in to tighten those ligaments again, so you don't have an unstable ankle and just keep re-spraining it and ultimately getting arthritis. Same thing happens in every other joint. If you get, hit on the outside of the knee, it stretches this MCL, then you have a loose MCL, and then everything's all wobbly and you develop arthritis faster. So we can actually put those platelet cells that would have responded the first time you injured it into this chronically loose ligament and help tighten that up and stabilize the knee. So this is how that process works, is we would actually take this is my specialty in interventional orthopedics and regenerative medicine. We do a lot of platelet-rich plasma. So take your own blood, centrifuge it in a sterile lab, pipette off just this platelet layer with a little bit of that plasma, and then inject those concentrated platelets into the areas of tendon degeneration or ligament laxity. It's very effective at repairing kind of these tissues that can be painful, loose, damaged. Also good for mild to moderate arthritis. We can also take those platelet cells and lyse them, which means break them open to release just the growth factor from them rather than putting whole platelets in there, which are very inflammatory. The platelet lysate is better for around nerves, and so I talked about how that can be helpful too. The next issue that can contribute to or help prevent against aging is the fact that we have this inherent ability to repair, and that's due to native stem cells, meaning stem cells that are in your body tissues anyhow, they're constantly keeping up with the small damages that come with time. So this is an interesting graph showing how many stem cells are in a different place. So this is in the iliac crest, which is kind of the area of the hip pelvis. You know, if you've got your sacrum here and your stack of, you know, spinal column going up, this iliac crest up here is where a lot of your bone marrow stem cells live. And it's a very rich source of stem cells that ultimately is where all of your blood cells come from. There you have some age-related decline. So this is age, and it does start to drop, but you still have, you know, pretty good cell counts at age 80 compared to at age 30. Compared to in the knee, which those local stem cell populations start to drop pretty quickly once you're in your 30s. And so what we can basically do is a stem cell transplant from your own pelvis bone, where you've got a lot of stem cells, down into the knee where you don't have very many stem cells. So these are your own cells. Fortunately, you don't lose them as quickly in some areas of your body. So what these cells do, on one hand, they're able to differentiate into different stem cell types, into different cell types. That's why they're called stem cells. They can become cartilage, they can become tendon. They can also self-replicate, so they can continue their own line, or they can divide. But they also secrete growth factors that stimulate neighboring cells to repair and modulate inflammation. So part of their role is in becoming the cartilage cells. Part of their role is in secreting things that influence pain and breakdown and improve healing through influencing other cells. This other neat thing they can do is through their mitochondria. So mitochondria are the organelles, the mini organs that are in each of your cells that are involved in breaking down food for energy, and they deteriorate with age. As you get older, your mitochondria become less functional. In people who are athletic, they actually have better functioning mitochondria even into old age than people who are sedentary. So part of the exercise response may actually be by training your mitochondria to better break down food for energy. One of the ways that stem cells are actually able to help with cell function is by donating their healthy mitochondria. So the stem cells have young functional mitochondria, and when they tag those, they actually find that they are donated and then present in cells that were not descended from the stem cells, that the mitochondria were able to move from the one cell to the other and now help that second cell function better. And that's been held up in a couple of studies. So coming back to the beginning purpose of this, how can you protect your joints, preserve your joints, and remain active in the face of, you know, not recovering as quickly and getting injured more easily? The standard approach for this has been through surgical orthopedics, which is, you know, surgeries are for the most part either fusing things or removing things based on how they look on an MRI. So if a tissue is abnormal looking, like that meniscus tear, they would recommend removing it or covering it up with a steroid shot. If a joint is unstable, they would fuse it and really only consider instability in the setting of completely torn or still intact. You know, that's when they would recommend treating an unstable or loose ligaments. It would only be if they were torn all the way. And also surgical orthopedics has gotten so specialized that they tend to only look at one joint at a time. So if you come in with knee pain, they're going to look at your knee, see whether there's any tissue that's degenerated and could be cut out. Not really thinking about your hip muscles, your back nerves that go to your hip muscles, whether your flat foot's rolling in and causing all kinds of abnormal knee motion. It's a very kind of fragmented way of looking at the body. Interventional orthopedics instead is kind of this other paradigm that I'm introducing you to, where we're trying to stabilize that tissue. So even if that meniscus has some tears, that's okay. People have those. You just want that tear to not be causing pain. So you need to modulate the inflammation in the knee using your growth factors rather than cover up, and then stabilize that tissue so it's not causing you pain. You can also stabilize the muscles or the ligaments and tendons, even if they're not all the way torn, to help with that same feeling that's causing the pain. And then looking above that at the nerve muscle to try to improve the function of the whole unit. We look at every joint in the body and try to see how they all influence each other. And going more in this interventional orthopedics route, especially for those kind of wear and tear athletic injuries, will ultimately get people back more quickly, and with decreasing your chance of doing something that you can't come back from. We've all seen people who've had a couple meniscus surgeries and then need a total knee replacement. It's a pretty quick progression that's expected. So anything you can do to help try to preserve and stabilize those tissues will help you operate at that higher level that we're all trying to be at. So that's how Regenexx really looks at this. They use this SANS approach: stability, articulation, neuromuscular symmetry, and I agree with this completely, where the stability of the joint is going to be related to those things outside the joint, the ligaments, the tendons, and the muscles. The articulation is where the standard medical practice tends to focus: the cartilage, the meniscus. We can help those too, but you don't want to just focus on the cartilage and meniscus. You need to look outside of that to why did you wear out that cartilage and meniscus in the first place. The symmetry is another part of that picture, where if you've got imbalances front, back, or right, left, you're going to wear things out faster. So we're really trying to focus at that earlier level to balance things everywhere to reduce the risk of future wear. And then the neuromuscular is, like we talked about, muscles are what keeps you in that healthy range of motion. And if you may not be able to activate them, even if thinking about it, even doing physical therapy, that you have to also be competent at treating nerves, which is uncommon in orthopedics or in sports medicine. There's not a lot of overlap between the sports medicine people who do peripheral joints, hips and knees and shoulders, and the interventional pain spine people that do back injections. But Regenexx feels it's very important to actually be versed in both and able to treat the spinal nerves and the peripheral joints, because they're definitely related. So hopefully I've given you some useful tips that you can incorporate into your exercise and lifestyle. If you have other medical questions, I would encourage you to make an appointment and we can talk about them. Consultations are covered by insurance. If you're not ready to do that yet, we do have a regenerative specialist who can answer common questions about, stem cells and PRP and what is regenerative medicine, interventional orthopedics. Or you could just check out Regenexx.com, Regenexxedina.com. That has a lot of good research. So Regenexx has been following our outcomes since 2006. We published the outcomes of patients' functional outcomes over time, as well as like before and after MRIs. And Dr. Centeno has a great blog where he comments on studies that come out. So very good resource to kind of do some of your own explanation before coming in. But good luck and thanks for listening.